that we can answer them at the end of the 4 talks. So now we'll turn on to Luis Vazquez, originally from Guatemala City in Guatemala, who has recently finished his EACTA Cardiothoracic and Vascular Anesthesia Fellowship in Milan, in Italy, and who is now working as a clinical fellow at the Western University in London, Ontario in Canada. And Luis will talk about the fellow's perspective on the important organizational issues of the fellowship from a viewpoint of fellow for non-EU fellows. Luis, please.
First of all, I want to thank EACTA for giving me this great opportunity to present an important topic. And at the same time, I want to give some insight to anyone trying to apply to the EACTA Fellowship Program. The title of the talk is Important Organizational Issues for Non-European Fellows, the Perspective of a Fellow. I just want to point out that it's not about if you are or not European, rather than where did your training took place. So if you got trained outside the host center country you want to apply to, this talk is made for you. I have no conflict of interest, nothing to disclose. And the outline of the talk is, first of all, why applying to the EACTA Fellowship Program, in a way, as a foreign-year trainee, is it worth it to go through all the things, a fellow needs to go to apply and be successful? How to choose your fellowship, what challenges to expect, how to overcome them, and some final thoughts. So from this first image, we can learn how the EACTA Fellowship Program has expanded around the world. And now there is a host center in Brazil. It also helps me to make the point I was discussing previously. If you got trained outside the host center in which you want to apply to, then you're going to have different challenges in a different path that someone who got trained in the same place where the host center is. So first of all, why applying to the EACTA Fellowship Program? And I always like to bring up Dr. Atul Wande, who wrote the checklist manifesto, the checklist we use every day in the OR room. And when he in his TED Talk explains how he got there, he recounts his personal experience and how after a couple of years of being a surgeon, his complication rates began to increase, and he wondered why. So he looked for a senior surgeon to watch him and give him advice, how he could get better. And at that point, he understood the importance of a coach, of a mentor. And I think that the EACTA Fellowship Program actually has that. You're going to get mentorship to get better, not just to learn, cardiac, thoracic, vascular anesthesia, but how to do better your job as an anesthesiologist. A second point that the EACTA Fellowship Program is going to give you is the opportunity to combine knowledge. If you were trained, in North America, South America, or any other place, and you go to Europe, you're going to find that things are done slightly different as how you are used to. And I have a couple of examples of that. This paper published a couple of years ago was a global survey of anticoagulation management during cardiopulmonary bypass. And if you see, the response of New Zealand and Australia and South America and Europe, you're going to find that they don't agree in the same thing. So there are slight differences in the responses of how they manage the anticoagulation during the cardiopulmonary bypass. Another example is if you compare the guidelines of anticoagulation of North America and Europe, you're going to find a couple of differences, maybe not big things, but things that are done differently. Now, if you're able to combine, the knowledge that you already have with the knowledge of how things are done in Europe, then this is going to be a fortitude, a virtue, and it's going to give you a surplus. So this is a great advantage of going to the EACTA fellowship. And a third point is that you're going to be part of an association that is committed to provide high quality training, cardiothoracic, vascular anesthesia, and intensive care medicine. The past year, I had the great opportunity to join the board of directors of EACTA to write this interesting article, which I advise you to read, about the transition and how the fellowship has transformed into today a place that is and gives state-of-the-art training. Shortly after, it was published the first curriculum, which now standardized the training among all the host centers that are certified by EACTA. And this is a big step. It's something that EACTA is going to give you after the application. So how to choose a fellowship? We already discussed, that EACTA is going to provide and is going to be worth going through all the things to apply. Now, how to choose your fellowship? Under my personal perspective, I think that these 5 points, address the important things to consider. First of all, a fellowship has to have a flexible clinical schedule that is going to provide, the opportunity for you to achieve your short and long-term goals. Second, a fellowship has to be able to provide you with a high volume of patients to be able to actually learn cardiac, thoracic, and vascular anesthesia. The fellowship has to be board-oriented didactics and has to have strong mentoring, as we mentioned before. And at the end, and not for that less important, the environment. You need to be in a comfortable environment to actually be able to understand, study, and work. A couple of years ago, this paper published in order for those trainees looking to achieve an academic career. And they point out essential ingredients to get that. And one of those is mentorship. So again, I'm sorry that I insist so much in that, but under my personal experience, that is one of the most important things that you can achieve after applying to the fellowship. Good. So what challenges to expect? So there are going to be many challenges that you can find in a way towards the application during the fellowship, but if you want to, you can crush all of them.